Hi, my name is Lisa Zamek. I'm a nurse practitioner student at GCU. I'm going to be doing your physical exam and health assessment. First, I'm going to do some hand hygiene, gather my supplies, and now I'm going to obtain some patient information. What is your name and date of birth?
My name is Padilla. My date of birth is March 1st, 2000.
Cool. And then what is your gender and race?
Hispanic and male.
Okay. And then what brings you here today?
Just to physical sports.
Okay. Thank you. Well, I'm glad that you're doing that. If you had a problem, I would be asking you the HPI of that, which is using the history of present illness using OPQRST, so onset, palliative, prerogative, quality, radiation, severity, and time. Is it constant or intermittent? So now we will go into your past medical history. When was your last physical exam?
Physical exam was probably 2-3 years ago.
Oh, so you don't go annually then?
No.
Okay. Are you going to be making an appointment soon?
Yes.
Okay. Was there anything of note in that appointment?
Nope.
Okay. Have you had any recent hospitalizations?
Nope.
Any chronic illnesses?
Nope.
Any allergies to medications?
Nope.
Substances?
Nope.
Or drugs?
Nope.
I mean, medications, substances, or environment?
Nope.
Okay. And then do you take any medications?
Nope.
Have you ever had surgery?
Nope.
If you did have surgery, I would ask also about anesthesia complications. Do you have any psychological history? Have you ever been hospitalized for anything psychological?
Nope.
Do you have any infectious disease exposure?
Nope.
Are your immunizations up to date?
Yep.
Okay. Do you get an annual flu or COVID vaccine?
Yep.
Okay. So that was through. The rest of that's going to come through the social. Oh, and I'm going to ask you some uncomfortable questions about your sexual history. Don't answer me, but do you have any, are you sexually active? And I would want to know your partners and how are you protecting yourself against STI? And do you have any history of STI? Okay, now I'm going to obtain your family history. I want you to think about your parents, your maternal and paternal grandparents, your parents and your siblings, and do you have any children?
No.
Okay, so we'll stick with that. First of all, what is their ages and names? Their ages and their general state of health if they're living, and if they've died, what was the cause of death and age they died?
Do you want to do my grandparents?
Sure.
So my grandparents, on my mom's side, my grandma's in her 50s, no medical history at all. She's still currently living in stable health. My mom, same thing, in the 40s, no medical conditions, perfectly healthy. My father, in his 40s, healthy, no medical conditions. My grandfather, my dad's side, he's 60, 70, just takes some medications for high blood pressure, but apart from that, perfectly healthy.
Okay, good.
My sister, again, 14, perfectly healthy.
Okay, so maternal and paternal grandparents and your parents and your sister all living and healthy.
Yep.
Okay, we're going to be a little more specific in some of those. I'm happy to hear that. That's wonderful. In some of those areas, just to make sure that you've thought of everything. Do any of them have any neurological or psych history? So ever had strokes or Meniere's disease, things like that? Well, that's ears. And none of them have been hospitalized for psych. Do any of them have any head, eyes, ears, nose, or throat history?
Nope. Any
CV, cardiac or respiratory issues?
Nope.
Bowel or bladder?
Nope.
Musculoskeletal, endocrine, hematological, or lymphatic?
Nope.
And do any of them have substance abuse?
Nope.
Any obesity?
Nope.
Any cancer?
Nope.
Okay. That's everything there. Now we are going to, I don't even look at these, but I am trying to cheat, aren't I? Okay, and I asked you that. So now we're going to go into your, that was family medical history. Now let's look at your social history. Do you smoke cigarettes?
Nope.
Do you drink or do any drugs?
Nope.
Do you, okay. Wait a second. Do you smoke, drink, or do any drugs? It's of course obviously big social history. Have you ever served the military?
Nope.
Are you, what's your occupation?
Student.
Student, okay. What level are you in school?
Junior, I'm going to my BC.
Good for you. What do you study?
Engineering. Biomedical engineering.
Oh, biomedical engineering. Okay, cool. And then, let's see, what are your living arrangements? Do you live in a single-story home? Or do you live
I live in a single-story home.
Okay, with your parents. Okay, good. Does your job support your lifestyle?
Yes.
Okay, so you don't have financial or emotional stress?
Nope.
How do you sleep at night?
I sleep well. I try to get the 48 hours.
Good for
but
you.
I sleep and I don't wake up. I don't have trouble sleeping.
Okay, good. And how's your nutrition?
Nutrition's good. Could be better, but
Okay.
I'm not.
You are a student.
Yeah. I'm not starving. I'll put it. I don't go to bed hungry.
Okay, good. Do you exercise?
I do. Try to.
How much do you
2 to
exercise?
3 days a week.
Okay, do you do at least 30 minutes?
Yes.
Okay, and what are your hobbies?
Hobbies, probably sports, volleyball, soccer, and I like to do a lot of reading.
Oh, good. Right on. We'll talk reading afterwards because I
Okay.
like to read too. Do you feel safe at home?
I do, yeah.
Okay, good. And then you said no military history. You live with your parents. Significant other?
No.
Okay. And then where were you born?
I was born here in France.
Okay. But you're Hispanic?
Yes.
Yeah? Okay. Okay, now we're going to go into a verbal review of your system. So we're just going to talk about what you've got going on.
Okay.
Okay. How would you perceive your overall health?
Overall health is good. Could be better. A little bit overweight, but I'm working on that.
Okay. Are you dieting?
Yes,
Oh.
dieting. Oh, not a strict diet, we'll say. Just less focused on processed foods and trying to focus on like cooking my own meals.
Oh, good. So this touches into a little social history, but I forgot to ask, and since you brought it up, are you restricted in any like salt intake or carb?
No.
Carb. Okay. Now for your eyes, have you noticed any head, eyes, ears, nose, and throat? Have you noticed any persistent headaches, dizziness? Do you have any blurred vision or floaters in your eyes? Any nose problems that you? Okay. Any ear drainage or pain?
Nope.
Muffled sounds? Do you have any trouble swallowing or noticed any lumps on your skin? Do you have any new things that you're worried about? New purpuric lesions? Or, okay. When was your last dental exam?
I want to say a few months ago.
Pardon me. Is that something you do annually?
Yes.
Okay. As every 6 months and 12 or just 12?
It's 6 months and 12.
Okay. Yeah, they've increased it. They allowed that a long time ago, so now it's kind of cool. All right. Now what about your eyes? Have you had an eye? Do you do annual eye exams?
Yes, I do.
Okay. When was your last appointment?
December.
Okay. And then any sores or lesions noted in your mouth? And did I already ask about the dentist?
Yeah.
I started at the dentist, then we go to the eyes. Okay. Now let's move into we already did your throat. You said no swelling, no problems there. Chest and lungs, any palpitations, shortness of breath with exertion, racing, skipping, heartbeats, anything. Bowel and bladder, any leaking, burning, urgency, frequency. Nope. Do you have a good normal bowel movement every day? Is it irregular? And is it normal, soft and brown?
Yes.
Okay. Do you use any laxatives?
I do not know.
Okay. That's kind of I don't know where that one belongs either, but I'll ask it there. What about your caffeine use?
I don't drink any coffee.
None at all?
None at all.
Good job. And then do you have any difficulty breathing or cough?
Nope.
Okay. I asked about bowel movement. Oh, any painful joints that you've noticed except for where you had, that's a scar.
Yeah, it's just a scar.
How'd you get that one?
Skating.
Okay. But do you have any skin? No, wait, I already asked about skin. Painful joints, range of motion, things like that. Okay. Any, and I already asked you neurological, any depression, anxiety?
Nope.
Okay. Do you feel like you get sick easily?
Nope.
Do you get hot or cold frequently? Any, or night sweats?
Nope.
I have any unintentional weight loss or gain?
Nope.
Okay, and then do you bruise easily?
No.
Okay, so that should cover those. Now I'm going to do the initial physical survey. Sorry, I just realized it wasn't looking like it. Oh. Sorry, guys. Okay, so the initial general survey, well appearing, malodorous individuals, hygiene is good, his posture is upright, he appears, I'm just doing general surveys, so there's no rashes, no erythema, skin is warm, dry, and pink, face is symmetrical, skin looks good. I do visualize a scar on his left elbow. If there were any other spots that you were worried about, like nevi or hemangiomas or any of these are all like just little nevi, flat macular things, I would investigate those for ABCDE, which is area, border, color, diameter, and if it's evolving. I will now obtain your Snellen chart from my assistant that got me that. That's telling me that optic nerve 1 is intact. And now I'm going to, okay, so this kind of throws me off because it really should be something. Your hands are a little clammy. Am I making you nervous?
Yeah, a little.
Cap refill is good. Skin is warm and dry. We've got good cap refill in his fingers. There's no clubbing, no jaundice or erythema noted, no joint swelling. I already told you about the scars. Now his hair is, well, now I'm going to go into performing that initial history. So I'm going to palpate your head. It is normal cephalic, atraumatic. There's no dandruff or flakes noted. No inhabitants, so that is intact. And while I'm palpating back here, I'm going to palpate the occipital lymph nodes. Now I am looking at his face is symmetrical. I'm looking at his eyes, the conjunctiva. Oh yeah, sure, conjunctiva. Thanks. The conjunctiva, lens, sclera, cornea, and iris. They are. We'll check here. Look up. Good. Conjunctiva look good, good, and so do the sclera. They're clear, not ecteric, jaundiced, or white. I'm gonna check your pupils. Oh, you got pupils nice and big. I should be able to see them. Quick, cover them up so they get big again. So his pupils were equal, round, and reactive to light with a consensual reaction. Let's see. That was that one. I'm gonna have you follow my pen. We're gonna go all the way just with your eyeballs. That's good. And then we're gonna go up and down, and now into this corner and down. Okay, so good. EOMs are intact. That's 3, 4, and 6. Take them off because now we're gonna look at your eyeball. Okay. This way, turn your head at me. And if you look at my ear right here, you see a red reflex on that one, and then saw the red reflex there. Okay, the disc to cup ratio was 1 to 3, which is normal. The fovea and macula were visualized. Thank you. The fovea and macula were visualized. I saw a retina and I traced it in. I'm not doing as well as I did the last time. I was taking it for granted. Okay, so we did the red reflex. I saw the fovea and macula visualized. It was a 1 to 3 cup ratio, disc to cup ratio. I got your Snellen chart results, so I know optic nerve 2 is intact. 3, 4, and 6 were your EOM. So 4 is your trochlear, 3 is your oculomotor, and 6 is your abducens. So those were all intact. Now I'm going to. You feel me touching? Does it feel the same on both sides? Good. I'm going to take these off again for a second. Just and for a second, because I got to look up your nose too. I mean, I will not all the way look up your nose. Okay, I am palpating his temporal arteries, checking for temporal arteritis. Open your jaw. Good. Close it. Any pain? Nope. One more time and move it side to side. Good. And now close it and bite down. Good. All right, so that is your facial nerve, trigeminal. You felt me touching you in all 3 areas. That's cranial nerve 5. Yes. And we tested now facial function. So raise your eyebrows for me. Wait, there you go. There you go. And now clench and close. Good. Puff out your cheeks. Good. And stick out your tongue. Good. And big smile. And now stick your tongue out again and move it side to side. Good. And now stick it out again and say, wait a minute. Yep. And say out. Again. Good. Okay. While I was looking in there, I see your anterior and posterior pillars of your tonsils. I also saw your uvula rise, and so let's go through cranial nerves. Number 2, we already talked about your vision is intact with the Snellen chart. 3, 4, and 6, ocular motor are intact. Your EOMs are intact. 5 is your facial nerve, which is intact in sensation and in motor. Cranial nerve 7 is intact with your symmetrical eye raising and opening of the jaw and clenching down. We're going to get to the ears with ocular motor 8, but on the glossopharyngeal, the vagus, and 12, the hypoglossal, tongue is midline, so that's cranial nerve 12, and cranial nerve 9, glossopharyngeal, and 10 will work together. Swallow for me. Can you swallow? Any problems swallowing? Nope. Okay, good. So that is the glossopharyngeal. All right, so now we are going into your hearing. I don't see any ear pain or drainage. Any pain when you palpate? Nope. Okay. And then tell me when you stop hearing this. Tell me when you stop hearing it. And when I compare this to the air conduction, it should be a 2 to 1, which is normal. Wow, good. You have pretty good hearing.
I like to preserve it.
Yeah, okay. And now we're down. Tell me when you stop hearing it. And this should be, like I said, a 2 to 1 air conduction. Should be almost gone. I can't feel it vibrate anymore. Good. Okay. And then do you hear this equally on both sides?
Yep.
Okay, so this was the Rene, which is a 2 to 1 air to bone conduction, which is normal. This is the Weber, and he said it was equal on both ears. There's no drainage noted, so now I'm going to take a look at it. The malleolus and the incus are visualized. TM was pearly gray with a conal light visualized at, and there was no drainage or cerumen impaction noted. Now we're going to check his, I already checked your hearing. That was 8, cranial nerve 8, vestibulocochlear. Oh, let's check your whisper test. I'm sorry. Did you hear me? What did I say? Good. Good. That one was a little tougher because I said it right in front of your face. So now I'm also looking at your nose. There's no drainage noted. Can you cover one nose and breathe in and out? Good. And now cover this one. Nose is patent. Can you smell this? Yep. So his olfactory function, cranial nerve 1, is also intact. Now I'm going to inspect his mouth and gums. Pink and MOYST. There are no lesions at his vermilion border. Open up for me. Good. And I would take my piece of gauze and move your tongue side to side. Dentition is good. You can close your mouth. And that was where I already checked 9, 10, and 12 with your swallowing with no pain. That all works together to make your tongue swallow and your mouth speak. And if you were unconscious, I would use your gag, but I'm happy with swallowing, showing that you're intact. Your gag is intact. So now I'm going to, I looked at your head already, but let's now go into your neck. I'm feeling your preauricular lymph nodes, your posterior auricular, and now into your tonsillar, submandibular, submental, anterior cervical chain, posterior cervical chain, supraclavicular. Okay. No enlarged lymph nodes. Can you swallow for me? Good. Sit up just a little bit. Swallow. Okay, good. No enlargements, nodules, or pain noted. Swallow function is intact. and check your carotid pulse. Good, that's a 2 plus. 2 plus. And then if you can look to the right side, no JVD noted, and look to the left, no JVD noted, and that should cover the neck. Now we're going to go into your posterior thorax. So you can put your glasses back on if you want. I'm gonna have you sit up just a little bit. I'm inspecting your back. Your AP diameter is 1 to 2. I will. Any pain across any of this area? Okay. I'm gonna assess diaphragmatic excursion about the 10th rib. Take a deep breath. And exhale. Very good. Can you say 99? 99. This is tactile fremitus. And okay, now I'm going to help you. Can't really hear very well. It's a little loud here. This we do across 8 areas. That was 4, 5, 6. Come over here and assess for diaphragmatic excursion. I do not hear. All right, now take a deep breath. Okay, that was about 2 to 3 centimeters, which is normal for diaphragmatic excursion. Now I'm going to do this one. 6 areas. And this would actually be under your shirt, skin to skin. Yes, we're simulating listening to 8 areas, skin to skin. Lateral and a little more lateral. Okay. All right, go ahead and lean back. We're going to do somewhat the same thing, only pain in your sternum or in your chest across this area. Okay, so now we are going to, I'm assessing the thorax. There's no bulges, there's no, he's got his shirt up. There's no deformities noted in your sternum or clavicles. Chest expansion is symmetrical. There's no bulges or protrusions in his abdomen or chest. But now we're going to look for any heaves and thrills, which I do not see or feel. Tactile fremitus, 99. And one more. Very good. Then we're going to percuss these areas during. Feeling for any across the spaces there. Okay. And now we're going to listen. Doing, again, this would be skin to skin, doing 8 breaths, 2, 3, 4, 5, 6, 7, 8. Excuse me. Okay. Okay. I should have left those in my ears. Now I'm going to listen to your carotids for their pulse. Good. And flip it around with the bell. Good. While I have this, I'm going to go ahead. I already did heaves and thrills. There was no abdominal pulsation, so now we're going to listen to the heart. Bell first. Second intercostal space, right lateral borders, aortic. Same spot, left side, pulmonic. Third intercostal space is Erb's point. And we've got pulmonic valve, tricuspid, mitral valve. And point of maximal impulse, I'm going to listen here for 20 beats. I do not hear any murmurs, clicks, or anything else. And now I'm going to go back through and listen with the bell to all of the areas again. So, pulmonic, Erb's point, tricuspid, and mitral. Okay, I'm good. While I have these in on the bell, I'm going to listen also to, I'll bring you back just a little bit. Do you want the bell off?
Sure, if you don't mind.
Nope. I'm going to listen to your renal artery. Listen for any clear, iliac artery. And now your aorta. That was fine. I'm gonna flip this around and listen again to the renal, iliac, and femoral. Yep, that's right. And I feel a little out of order and out of sorts. I mean, I'm in order, but in my head, I want to go.
Structurally.
Kinda. I mean, more like I'm in this whole thing. I want to get all the things done. So, okay, so I did, all right, we did palpations there. I'm done with the cardio and respiratory. So let's move to the abdomen. I inspected already. There were no bulges, protrusions, anything like that. I'm going to auscultate your areas, listening for bowel sounds. That's what I mean. I wanted to leave them in and go, but I had to verbalize the bowel sounds in the quadrants. I'm going to percuss belly, and I'm hearing taken as expected. Now I'm going to palpate lightly. Any pain when I palpate? No. And now we're going to go a little deeper. This is McBurney's point, like if you had appendix things. And let it go. Did it hurt? Take a deep breath. Nope. We're going to do this again over on your right side.
See, they're up at the top. In those.
Take a deep breath. Any pain? Okay, so that, and one more time. Okay. Any pain here? Any pain there? Okay. So his liver did not drop, nor was there pain of inspiration. The liver, let's check the liver scan. So, liver span is about 8 to 10 centimeters, which is normal. While I'm over here, I'm also going to palpate for the kidney, which I do not feel nor would I expect. And while I'm over here, I'm going to put your arm just like this. I'm going to palpate for your spine. Don't expect to see or feel that. Okay, so that's good. And then feeling that, and if you can feel any tenderness. Okay, good. All right, let me see this one. There you go. There were no aortic pulsations or palpable masses. During the femoral listening, I would be palpating the lymphatic and the femoral pulse. Did you do your own testicular self-exams? Do you know how to do them?
Yeah.
Okay. We would talk through that if you didn't already. All right, so now What's that? Testicular torsion? You don't have any history of that? No. Okay. While I have you like this, I'm going to lay you just a little bit flatter again. I guess I raised you up too soon. Lift your leg all the way up for me. Good. Don't let me push down. Okay, good. And put it down. And same thing over there. Lift it up. And don't let me push down. Good. Can you run your heel along your shin there? Yeah, do it both ways. Yep, that's good. And the other way. Very good. Note the shin is intact. And we assessed your hip. Can you take them abduct and adduct of your hips?
So lefty going.
That'll
out.
work. Yeah, varus and valgus. That's very external rotation, internal rotation. That'll work.
Okay. So how would you?
No, it's okay. When you stand up, we can do it this way as well.
Oh, like
but
this?
yes,
Oh, okay.
but that what you did is actually a little easy. I think it's easier in the bed, but I suppose as long as you're comfortable. Okay, so now I'll have you sit up on the edge of the bed. And look, yeah, that's fine. We're gonna do a little motor test. So any pain, I'm looking at extremities are normal. He doesn't have any swollen joints or fingers. Oh, what happened there?
The softball.
Got a little abrasion. Okay. I don't know why I was looking at your veins. Like, okay. Just the nurse, I know. All right, raise your shoulders for me. Good. And don't let me push down. Good. All right, relax and push against my hand. Good. And again. Okay, so that's cranial nerve 11 is intact. Can you do this? Good. Flexion extension is intact. Very good. Can you do, yep, and this way. Good. And then bring your arm across. And bring your arm across. Good. Okay. And now hold your arms up like this and pull. Good. And push. Good. That's good strength there. And then same thing. Squeeze my hands. Good. Good strength there. Show me your hands. Bring them together. Squeeze. Good. And then do this. Very good. Patty cake. Supination, pronation intact. We checked flexion and extension. I'm going to do that one more. Did you go out?
No, I did not.
Okay. Excuse me. There we go with extension. And then can you touch your finger to your nose? Now touch my finger. Good. Again, touch your nose. Touch my finger. Very good. And now we're going to check your sensation. Do you feel, is this sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp.
Good. Okay. And then we're going to check. Yeah, actually, let me do it on this arm so it's better for the camera. I'm going to have you, you keep your arm relaxed. Yep, just relax and let me hold it. I feel like you can, oh, you're, relax. I can feel this in my hand. Do you feel it reflexing?
A little bit, yeah.
Okay, so that one was there, and then we come up on this radial stylus. Okay. Relax. You're going to do it through my thumb because you've got a plexus of nerve cells there, so that's the best way to do it. We do finger to nose. Now we'll do pronator drift. Hold your arms out. 10 seconds. Close your eyes. That's all right. I hit into you. All right. Very good. No drift. Okay. Let me check your sensation here. Oh, I know what I forgot to do while you were laying down, like a allotment test. That's something. I would be. Can you feel that? Sharp or dull? We would be going through your sharp.
Yep, sharp.
Okay.
Sharp.
Yeah. Okay, so sharp and dull work. Can you rotate your ankles in a circle? Good. Bring them up and down, and then toes to the floor, and then toes. Toes and then pinkies. You got it. So that's varus valgus, and then let me have you stand up and Now can you lift your knee up? Good, good, and put it down. Lean knee up again, down. I'm sorry, second time. Sorry. Yeah, and then now pull back. Good, and pull back. Good, and push out. Good. 5/5. Strengthen all of your extremities. I did sensation motor. I did drifter. Okay. So, while you're sitting up, I'm also going to adjust your axillary lymph nodes, anterior lymph nodes, posterior lymph nodes. That was the axillary. Something there. Nothing. 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 I checked your inguinal lymph nodes, supraclavicular, posterior clavicular. If you were female, we would be talking about breast self-exams as well. May have you stand up and do heel to toe to the curtain. Heel to toe. Oh, yes.
Oh, okay.
Yeah. Very good. And turn around and come back. Very good. Keep walk normal and then just turn around. Do you have any pain? No step off in a spine noted. Bend over and touch your toes for me. Very good. Nice move back. Come on back up. Hips are equal. Shoulders are equal. No pain on palpation. All right, let's do cervical. We're going to go lateral in this way. And now go flexion, extension. Good. Oh, and now look and look. Okay, good. Now let's isolate to the thoracic spine. If you can twist. Just the thoracic. Yes, yeah, there you go. And then lateral. Good. And I saw you bend a little bit, so we'll go forward. Yeah. Good. And now with the lateral, same thing. If you can isolate to the lateral, there you go, there you go. Twist, twist, and then extend and back, very good. And then one more thing. Turn around, stand behind you for stability. Can you close your eyes? This is called the Romberg test, so you have absolutely no wavering, so that is good. Go ahead and sit down. We did all of those. I feel like I missed some things, but that's it.